Welcome. In this video we are going to discuss about radiation effects. First let us see what is radiation. Radiation can be classified into two types, non-ionizing and ionizing radiations. Non-ionizing radiations are like visible lights, radio waves, and has enough energy to move the atoms but not enough to remove the electrons. Ionization radiation like alpha, beta and gamma radiation has enough energy to move electrons from atoms and creating ions. So, the electromagnetic radiations consist of photons that have energy but no mass or charge, such as radio waves, microwaves, infrared, visible light, ultraviolet, X-rays and gamma radiations. And a photon, as described by the quantum theory, is a particle or a quantum that contains a discrete quantity of electromagnetic energy which travels at a high speed of light. Particulate radiations consist of particles that have mass and energy and may or may not have an electric charge, such as alpha radiation, beta radiation, proton radiation and neutron radiation. In general, we classify the radiations as ionizing radiation and non-ionizing radiation. So, this picture shows how the radiation has its penetrating effect. Alpha, beta, X-ray, gamma ray and neutron radiation. So, here alpha, beta has low penetrating power when compared to X-rays and gamma rays. Let us see acute radiation effect. Radiation exposure can have various effects on the human body, ranging from mild acute symptoms to long-term health problems like cancer. High doses of radiation can cause acute radiation syndromes. Acute radiation effects refer to immediate and short-term health consequences of exposure to high doses of ionizing radiation. These effects typically occur within minutes, hours or days after exposure, depending on the dose received. What are the key aspects of acute radiation effects? So, radiation sickness, let us see the acute radiation syndromes and factors influencing acute radiation effects, doses and effects, management of acute radiation exposures and long-term effects of acute radiation. Let us see the acute radiation syndrome. So, acute radiation syndrome is a collection of symptoms that arise from a large dose of ionizing radiations, usually over a short period, that is minutes to hours. The severity of the acute radiation syndromes depends on the radiation dose and the type of radiation. Symptoms or prodromal stage, this is initial phase which begins shortly after exposure and typically involves nausea, vomiting, fatigue, headaches, and this stage can last from hours to days, so depending upon the radiation dose. Latent stage. After the prodromal symptoms subside, the person may appear to be fine, but internal damage is still occurring. This stage can last from a few hours to several weeks. So, manifest illness stage. So, this may include the syndromes like hematopoietic syndrome, gastrointestinal syndromes, cardiovascular or central nervous syndromes. Hematopoietic syndrome. So, it is a decrease in blood cell counts leading to anemia, increased risk of infections and bleeding. Gastrointestinal syndromes, several damages to the digestive systems resulting in diarrhea, dehydration and weight loss. Cardiovascular systems, damage to cardiovascular system and brain can lead to confusions, loss of consciousness and potentially death within hours to days. So, depending on the severity of the radiation dose, the recovery is possible with medical treatments, but in severe cases death may occur from multiple organ failures. Let us see what are the factors influencing this acute radiation effects. First one is radiation dose. Higher doses will result in more severe symptoms and increase the likelihood of death. And type of radiations, alpha radiations or beta radiations or gamma and neutron radiation, which has different level of penetration and effects on the body. Next one is duration of exposure. Longer the exposure periods can increase the total dose and the severity of effects. Next, area of the body which it is exposed. Localized radiation exposure may cause tissue damage, specifically in areas like skin burns, and while whole body exposure can also lead to more systemic effects. Then individual sensitivity, the person's sensitivity. So it depends upon age, overall health and genetic factors can influence how a person responds to radiation exposure. Doses and effects. So normally 1 to 2 gray generally causes mild symptoms such as nausea, vomiting, but recovery is possible. 2 to 3 grays symptoms become more severe and medical interventions may be needed. 3 to 4 grays, severe damage to bone marrow and the immune systems and blood transfusions and other treatments are often necessary. Greater than 4 grays are likely to result in severe, often fatal damage, and the prognosis depends on the immediate medical care and the dose. Management of acute radiation exposure. How to manage this? First one is decontamination. Immediate removal of the contaminated clothing and decontamination of the skin can reduce further exposures. Then supportive care. This may include intravenous fluids, antibiotics, preventive infections, blood transfusions and medications to manage the symptoms like nausea and vomiting. Bone marrow transplant. In case of severe bone marrow damage, stem cell transplants may be necessary to replace damaged cells. External radiation protections. Limiting further exposure by using shielding and relocating the patient from the radiation source. What are the long-term effects? Long-term effects. While acute radiation effects manifest quickly, long-term effects may develop years after exposures. These include an increased risk of cancer, cataract and other chronic health issues. Acute radiation exposure, especially at high levels, is a medical emergency and requires immediate treatment and monitoring. Thank you for watching.